going to talk a little sports medicine. Always enjoy our education with Dr. Joe Congini on Wednesdays at this time. And Joe, good morning. It's your platform. What do you have for us today?
Hey, thanks, Ray. And I love the education part, except today I think I'm going to have to tell you more questions than answers on the first two issues I want to just touch on a little bit today. And the first one is just a mystery, and everybody's asking me, so I can't ignore it. But I can't find any of the information on exactly where we are with the injury related to JOK. And JOK, the exceptional linebacker of the Browns, we talked about him 3.5 weeks ago when he got hurt against the Ravens, and he spent the night in the hospital, but the next day they said testing showed no structural injury and that they thought he'd recover. And now there's been a couple stories, even in the Cleveland paper and others, that there could be some issues of even career-threatening relation to this injury that we talked about a little bit. It was called cervical concussion, a concussion that comes out of the neck. And I told you that for sports medicine, it's one of the most difficult and concerning types of concussions we see, because often there's nerve injuries that are very variable as to how they recover. And that must be some of what's going on, because there's just no mention anywhere. I looked at least 20-plus articles, Ray, to try to get some information for your audience today. Very little mentioned, except a few people really concerned. And obviously there must not be a fracture, or that would be reported. Usually if there would be a bad disc injury, that would be reported. But this probably falls in the category of some sort of nerve injury with the neck part. Is it the bundle of nerves called the plexus that we call the stinger, where he had a more significant injury? Could there be some degree of a disc that they didn't, initially see in the initial workup? Or there's these born with abnormalities called congenital abnormalities, where the spine is formed irregularly, maybe sometimes narrowed, that is really hard to be able to play a contact sport with. And I really don't want to speculate much further, because they have not commented on any of these types of things. And typically in sports medicine, Ray, when that's happening, when people are not talking about this, this may have led them to a bruised spinal cord or something like that. When they're not talking about these things, usually it's because, number one, it's complicated and they're seeking other opinions, often neurologists or neurosurgeons, or even people we call physiatrists, that do testing on the nerves. They may be doing what's called serial testing, where every day to see if these nerves are coming back toward normal, but we don't know. There's no report about it, and I'm following it very closely, and you can be sure that not speculating now, but I'll keep your audience updated as we get information about this really bright spot of a wonderful athlete he's been the last couple of years, and so a lot of concern revolving and centering around this issue, and I'll keep you updated. Okay, Ray? Yeah,
that sounds good. What else do you have, Joe?
The other thing I wanted to talk about is more on the standpoint of exciting news. The national rankings that I follow, because I'm very involved and submerged in high school sports, and they are in all sports, but in football, they really give us pretty detailed national rankings in the United States, and they came out last week and said in the playoffs in the country, in the United States, Division II in Ohio is the 5th most difficult region in the country. Number 5 most difficult region for division playoff football. Hey, that takes into account Florida, Texas, Georgia, California, Ohio, number 5. And by the way, Division II is right here in Northeast Ohio, and they actually specifically mentioned several local teams. I want to tell you that the Highland Hornets, Avon Eagles, Walsh are all undefeated and have national rankings. Hoban and Massillon played epically difficult schedules. They're in national rankings. So you take those 5 teams in Division II, and that has vaulted this our Division II into number 5 in the country in difficult. So I want people to watch this week. If you watch on TV, if you go out there with us and get out in that what might be some snow Friday night and watch some of these games, you see how hard these kids have played for 14 weeks, how focused they are. These kids are 15, 16, 17, 18 years of age, and they play so focused. They've avoided injuries. They've stayed in good shape through a long time. That's 4 months of playing football, Ray, that they've been at it. Mm-hmm. And these kids from our part of the country, it's quite a tribute in Division II in Northeast Ohio. Those mainly because of those 5 teams that have national rankings. We're ranked number 5 most difficult in the United States of America.
Wow. You talk about we've talked about the aggressiveness of football, right? And then you got these extended seasons from a sports medicine standpoint. You love seeing the extended seasons on the other side, the wear and tear on these bodies, right, Joe?
Yeah, I've had that talk with you before, Ray, and I'm not wild about that. I have to be a realist, and I know part of it is that the playoff time is when the state, actually is able to make some of their money because the Ohio high school, makes all the receipts, the gate receipts from having all these games. But it's a lot of games, and it's a lot of games on everybody, on the medical team, but especially on the players. So we do watch it carefully, and I think coaches that have been through it a lot are really good, Ray, at managing minutes. Yeah, almost like the NBA managed minutes, of Donovan Mitchell the other night. I started to see high school coaches manage minutes early in the season, the first 5 games, the second 5 in the regular season, if they think they're going to make a playoff run, because 16 games to go to the finals. Right now they're at 14 games, everybody playing this weekend. But those games this weekend of nationally ranked teams right here in Northeast Ohio, that Avon Highland game is going to be a great game. Of course, Walsh and Hoban, good games. Keep an eye on those games and just think of how hard those young athletes have worked and how precise they are, how hard they work and how focused they are from a sports psychology standpoint, how good of a job they do. My hat's off to the coaching staff and the players. Yes, I do worry about the length of the season, though. That was your question to me, and that's something that I bring up on a pretty regular basis.
Even on the college side, right, Joe? Conceivably, Ohio State's football team could play 6 more football games.
Yeah, that is as they look down the road and say, hey, let's go 12. Hey, let's go 16 teams in the playoffs. Hey, yeah, those are young kids that are playing all the way since mid-August or early August. That's a long season, but you're right to be looking out for those kids, and I appreciate always your input, Ray.
Well, Joe, stay warm on Friday night on the sidelines, okay?
Thanks for thinking about me, because at my age, the blood thins a little bit, and I will be cold out there. But it should be a heck of a game, which always kind of makes it exciting.
No doubt about it. I look out for the kids, but I also look out for my good friends, Joe, and I want you to be warm, okay?
Thank you so much, Ray.
All right.